So hi, good morning. So I'm here to perform an incentive spirometry. So when doing this, first and foremost, we also make sure to check the patient's chart and then obtain any information which is relevant to this therapy. So once inside, we introduce ourselves. We also have to check the patient's ID band if they're the correct patient, and then explain it what the purpose of this therapy, such as this one, like, hi, good morning, Mr. Anthony. My name is Anthony. I am a respiratory care student from the respiratory department. So the doctor prescribed you this therapy, especially you just recently came from a surgery. So this would enable to help your lungs expand even more, and then it will also make sure that prevent any collapse of your lungs, and also this would allow to help you cough and expectorate any sputum or phlegm present. So this one is what we call an incentive spirometry. So when after this, make sure we inspect also the device for any cracks present, and then after that we reassess the patient, obtain vital signs, and make sure we auscultate them, which is relevant to this therapy. So once done, we always make sure we wash our hands. And then because the patient just came from a surgery, so we also have to check the goal, which, for example, if I was the patient, so my goal is about 2,000 in here, but because the patient, as I observed, they just experienced still some pain on it. Well, even though their goal is 2,000, I'll just have to let them do it about 1,000, so that I will not do it too much for them and cause any pain. And then, as what I mentioned, that the patient just came from surgery, let the patient position upright, and then you have a pillow in front of them to support. Such example, if there's a pillow in front of me, and then first is we demonstrate it to the patient if how to perform this so that they can do it by themselves later on. So first is let the patient exhale the air out until their lungs are empty, and then after that take a slow deep inspiration, and then once this piston, the white thing, would reach or rise in the top, let the patient breath hold for about 3 to 5 seconds until it drops. Once it drops, remove their mouth from the mouthpiece and exhale normally. So for example, I was the patient who just came from surgery. Even though it's 2,000, I just have to let them do until 1,000. So exhale. And then if the patient is able to tolerate, let the patient rest for a few seconds and do another attempt. And then if the patient still experiences pain, we can just let the patient do about 3 times or 5 times if they're still able to push through. But ideally, we must able to let the patient perform about 10 times per attempt. So the patient must be coordinated, must be able to fully understand and fully awake, and then it should be done waking hours or every hour if possible. And then if everything's been done, so make sure we put this back to the plastic container, and then with this mouthpiece, make sure if we can clean it up and then cover it with a clean tissue, and then should be put up sitting upright on the side. And then if possible, we can keep on coming back to the patient every hour so that they can even practice it more. And then once done with the therapy, let the patient cough every after attempt, and then everything should be done by taking up vital signs and re-auscultate it again. So because this patient just came from surgery, so make sure the patient is comfortable, and then wash your hands, and then document outside that, like, for example, even though the goal for the patient was at 2,000, I was just able to let them do 1,000 because they still experience any pain, and I just let them do about 3 times or 4 times until 5 times to prevent any complications. So I think